Good morning, everyone. It's Tuesday, May 12th. I'm Stephanie Haney. Welcome back to 3 News Now, your early update. We have the top headlines for you from WKYC.com and our WKYC app, and there is definitely a lot going on today, both here in Ohio and at the national level. So we'll be giving you a lot of information today, again, which you can find in more detail on WKYC.com and our WKYC app. We'll start this morning like we do each day, and we'll go over the latest numbers from the Ohio Department of Health. Those came in yesterday at 2 p.m. 2 p.m. each day is when we get those updated numbers. Here's where we stand right now in terms of reported COVID-19 cases here in the state of Ohio. Right now, we have a total of 24,777 reported COVID-19 cases in the state of Ohio. That is based on the expanded CDC definition. That includes people who have both tested positive for COVID-19 and also people who probably have COVID-19 based on everything the medical experts know without having actually had a confirmed positive test. In terms of the number of deaths, we are now at 1,357 total deaths related to COVID-19 here in the state of Ohio, again under that expanded CDC definition of both confirmed and probable deaths. Now, if we look at those numbers across the board, we are up in every single category from Sunday. That includes hospitalizations and intensive care unit total patients admitted. We saw 696 new cases yesterday. Before yesterday, when we got those new case numbers, there was a decline for a few days in the number of COVID-19 cases reported. Sunday, the number of new cases was 384, but then we popped back up to 696 new cases just yesterday on Monday. Also yesterday, we saw 16 new deaths. That's up from 10 new deaths reported on Sunday. Now remember, last week we saw a couple days with significant increases in deaths, seeing both 90 and 78 new deaths on 2 different days last week. And the previous week is when we saw the single largest 24-hour increase in the number of new deaths, at one point having 138 new deaths. So from Sunday to Monday, we saw 16 new deaths. That is an increase from Sunday to Monday. So we'll be watching that when we get that information today at 2 p.m. As of yesterday, we also saw 62 new reported hospitalizations. That is up from Sunday when we saw 51 new reported hospitalizations. And we saw 12 new intensive care unit admissions yesterday at 2 p.m., which is up from 5 new ICU admissions that were reported on Sunday. Despite that information, Ohio retailers are allowed to reopen today as part of Governor Mike DeWine's phased-in plan to slowly reopen the state of Ohio. So according to Ohio Department of Health official website, all businesses reopening today have to follow these protocols. All employees are required to wear face coverings. Customers are strongly encouraged to do so, but they are not required to do so. Daily health assessments will be made of employees, and employers will determine if those employees are, quote, fit for duty. Employees will also be required to maintain good hygiene at all times. That includes hand washing and sanitizing and maintaining a safe physical distance. And the cleaning and sanitation of workplaces throughout the workday will have to take place, as well as the close of business and between shifts. Capacities at places that are allowed to reopen today will be limited to 50% of the fire code, and if possible, appointments are recommended to be made for people. Now, this isn't something that's required, but something that I think might be interesting to take into consideration is if we talk to these businesses about possibly installing automatic doors, or if an automatic door is too cost prohibitive for these places to do that, maybe they should consider hiring a single person who can work the door, who can open the door and close the door, to limit some of that contact that we can expect from customers as they are entering these retail establishments. Something to think about there, which has not been included in the required protocols for businesses that are reopening right now. So according to the protocols from the Ohio Department of Health, if a coronavirus infection is found, businesses are required to take the following actions. Immediately report any employee or customer infections to the local health district. Work with local health department to identify potentially exposed individuals in order to help out with appropriate communication and contact tracing. Shut down for deep sanitation if possible. professionally clean and sanitize the site or location, and consult the local health department for reopening. So that's the best information we have right now, as retailers are permitted to open again for the first time since closing in March, pursuant to Governor Mike DeWine's orders. Here's another interesting fact. A large percentage of the economy is reopening in Ohio this week, about 90%, but not daycares. DeWine was expected to have remarks about this yesterday in his press conference at 2 p.m., since many daycares have been closed since March in an effort to stop the spread of COVID-19 coronavirus. But instead, Governor DeWine said that he is still gathering information for reopening Ohio's child care centers and wouldn't make any kind of announcement until he had all the facts. Here's what DeWine said. The mistakes I've made in my career have come about when I haven't had all the facts or didn't dig deep enough. So this process is continuing. Reopening child care centers is simply too important to do so without all the best information and protocols in place. Now, of course, that begs the question, how can the economy reopen? How can 90% of the economy reopen without childcare? Which is a question that many of you have been asking. I've seen it all over social media. And it's a good question. It's a fair question. And apparently it's a question that DeWine doesn't quite have the answer to right now. So we'll be keeping an eye on that as people are expected to go back to work. Another question that Lieutenant Governor John Husted didn't have the answer to is what would happen to people whose employers have now reopened. So you would assume they would potentially maybe not be eligible for those unemployment benefits, but don't have child care in order to take care of their children, who are not going to school, by the way, because schools have been placed on distance learning models through at least the end of the summer. So lots of questions there that the Ohio government will have to answer, and hopefully we'll have some answers on those questions today at 2 p.m. when we expect to see Governor Mike DeWine in another press conference. DeWine did say it is his hope that Ohio is a leader in this area and lays claim to one of the strongest policies on reopening daycares in the country. That is, when we do learn what that policy might be. Today, at the national level, Dr. Anthony Fauci and others are testifying before Congress. That is actually happening right now. You can watch that on Channel 3 on your TV. We are airing it. We also have it on WKYC.com and our WKYC app, as well as on our Facebook page, which is facebook.com/WKYC.channel3. So Dr. Fauci, who is the nation's leading infectious disease expert, said he intends to warn against a rushed reopening of the U.S. economy, which, as a reminder, has seen over 33 million Americans lose their job in the last 7 weeks. Those are just the Americans we know about, by the way, because in many states, like here in Ohio, many people have not yet been able to file for those extended unemployment benefits. We're talking about the 1099 workers, the part-time employees, people who have already exhausted unemployment benefits that they might be eligible for in their state. So a lot of people not represented in that 33 million number, but we do know that that is at least the number of people who are out of work here in the state of Ohio. So Democratic senators are expected to ask experts tough questions today about COVID-19, about the death toll in the U.S., about the nation's testing capabilities, and multiple outbreaks throughout the country, and the perceived failures of President Donald Trump's administration to handle the COVID-19 outbreak here in the U.S. Fauci said this: "If we skip over the checkpoints in the guidelines to open America again, then we risk the danger of multiple outbreaks throughout the country. This will not only result in needless suffering and death, but would actually set us back on our quest to return to normal." So Dr. Fauci is at odds with President Trump over this, who has repeatedly urged governors to lift business closings and stay-at-home orders. In addition to Fauci, others who will be appearing via teleconference will be Food and Drug Administration Commissioner Dr. Stephen Hong and Dr. Robert Redfield, who is head of the Centers for Disease Control and Prevention. All three of these people, by the way, are in self-quarantine following their exposure to a White House staffer who tested positive for COVID-19. Separately from those three experts, there will be one expert from the World Health Organization who has already warned that some countries are, quote, driving blind into reopening their economies without having strong systems to track new COVID-19 outbreaks. And three countries who do have relatively strong tracing systems, that's South Korea, Germany, and China, have already seen new outbreaks after lockdown rules were relaxed. So that's happening right now, and if you'd like to, you can watch that on 3 News, on your TV, on Facebook, and also WKYC.com and our WKYC app. And of course, we have continuing coverage about that hearing on the site as well if you'd prefer to read about it. Now, despite all these lockdowns and closures, reports do show that Americans are slowly returning to the road. The most recent data indicates activity during the week ending May 8th was 60% higher than the lowest point since the COVID-19 crisis began. Tim Harlow, who is a reporter for the Minneapolis Star-Tribune, said the data is showing that we're starting to move around a little bit more, and that could be attributed to people going back to work and maybe people just getting a little bit stir-crazy. Harlow said, "We're Americans. We don't like to stay at home." I think that's obvious from the urge for people to reopen things very quickly and everybody just getting a little bit stir-crazy, keeping to themselves at these times. So I think Harlow's probably right about that. Although some states are easing restrictions, it's not 100% clear exactly why road traffic is on the rise, though. That's according to Streetlight Data CEO Laura Schewel. Some people might be lured into their vehicles by nice weather. That's not exactly the case this week here in Ohio, though, but we did have a little bit of nice weather recently. But there have been a surge in some states that have not officially reopened yet. That's according to Schewel. So farming and other activities that usually pick up in the spring could also be factors. Now, if you were hoping to take advantage of those low gas prices, do pay attention that gas prices are actually on the rise as a result of more people being on the road, a little bit of more demand there. You know, here in Ohio, there were points when gas prices were under $1, which is something I haven't seen since before I started driving quite a while ago. Here's some news about the theater situation here in Northeast Ohio. Playhouse Square has postponed Hamilton, Frozen, and other shows that's due to COVID-19, and they also released an updated KeyBank Broadway series schedule. So Gina Vernacci, who is president and CEO of Playhouse Square, announced that several shows in the upcoming KeyBank Broadway series have been postponed to later dates in 2020 and 21. Shows that have been postponed include Hamilton and Disney's Frozen. So Frozen was originally set to open on July 15th, then that got pushed back to August 5th through September 6th before officially being put on hold without necessarily setting a new date. And Lin-Manuel Miranda's Tony-winning Hamilton, which has gotten rave reviews nationally, last played here in Cleveland in 2018, it was set for an almost 6-week run that was beginning on Tuesday, September 22nd. That's also been postponed without a future date known at this time. Other shows postponed include To Kill a Mockingbird and The Cher Show, and there are now new dates for the 2020-2021 KeyBank Broadway series. That will now begin in January. So Pretty Woman, the musical, that will begin January 5th. The Prom is scheduled for March 9th. Ain't Too Proud is scheduled for April 6th. Moulin Rouge, the musical, is scheduled for May 5th, and Hadestown is now scheduled for July 6th of next year. 2021. Those are all 2021 dates that I just told you. My Fair Lady and Jesus Christ Superstar will also both return in the summer of 2021. Vernacci did say that members of Playhouse Square will be reaching out soon in order to offer people refunds and ticket credits. So pay attention to that. If you are a member of Playhouse Square, officials will be reaching out to you in order to get in touch with you about that. There is some good news, though, if you are a Hamilton fan. Hamilton the movie is coming to Disney Plus on July 3rd. This is a filmed version of the Broadway musical, and it's going to be released more than a year earlier than it was first announced. In February, Lin-Manuel Miranda first announced the movie would be hitting theaters on October 15th, 2021, so more than a year from now. However, Deadline says that Disney beat out the competition and paid a huge $75 million fee for the worldwide rights to the movie. And with theaters shut down, Disney has decided it will release the filmed musical early. The movie will feature the entire original Broadway cast in their original roles. We have more details on that on WKYC.com and, of course, on our WKYC app. And we end with a heartwarming story that started as a big bummer for someone here in Northeast Ohio. A Cleveland nurse is now receiving donations to help replace items that were stolen from her car. Jamie Bird Beasley was absolutely heartbroken last week when she found out a thief had broken into her car and stolen supplies that she needed. Not just things that she needed for her personal life, but these were things that she needed in order to do her nursing job. So a GoFundMe account has now been established for the nurse, and it has now raised over $800. I believe the total right now is $860. It was established after several viewers asked to help her, and she woke up last Monday to realize her car had been broken into. So a week ago, she found out she had fallen on some pretty tough luck, an unfortunate scenario from someone who had taken things from her that she needed to do her essential work to help keep people safe. And when people reached out, they really stepped up for her. The total goal for the GoFundMe is $2,000. That's the amount that Jamie estimates is needed to replace everything that was stolen from her car. And these are the things that she needs to do her job. This includes a stethoscope, a thermometer, blood pressure cuffs, and glucometers. So if you would like to help out, we have the link to that GoFundMe.com page on WKYC.com and our WKYC app, or you can search this on GoFundMe.com. Frontline nurse medical equipment stolen. That's the search term that'll take you to Jamie Bird Beasley's GoFundMe account if you would like to participate in helping her recoup the cost of those things that she lost. That's your early update for 3 News Now. Next up, we have 3 News Connect. That's with Monica Robbins and Jay Crawford. Monica Robbins, of course, is our senior health correspondent. I'll be back here at 2 p.m. with your updates from WKYC.com, and as soon as we get those new numbers from the Ohio Department of Health so that we can continue to track what's happening with COVID-19 cases, deaths, hospitalizations, and ICU admissions here in Ohio. I'm Stephanie Haney. I'll see you back here in just a little bit.